Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Mary Washington Healthcare is committed to improving the health of the people in our community, and we take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share what we know about COVID-19 and what we are doing to keep you safe and healthy. During this town hall, you will hear from our expert panel, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Doman, Chief Nursing Officer for Mary Washington Healthcare. And our third panelist, Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. Dr. McDermott, if you could introduce us to the data here in our community.
Well, good evening, everybody. Thanks for taking a little bit of time out of your evening again to join us for our community town hall to talk about the impact of COVID on our community. I'll start talking just about the burden that COVID-19 is having on our hospital population. We have over 98 members of our community that are hospitalized currently between Mary Washington Hospital and Stafford Hospital that need inpatient care to help them battle COVID. We've been up at 98, 99 for the past few days. These are our largest and highest levels ever in the pandemic. At the state level as well, very, very prevalent. The number of hospitalized patients in the state, over 2,700 patients hospitalized in the Commonwealth. Our positivity rates, test positivity rates, and the overall prevalence in our communities remains very, very high in the state of Virginia. So we still have a lot of work ahead of us to decrease that prevalence in our communities. I appreciate everybody who's tuning in, helping us spread the word on the things we need to do to lower that prevalence here in the Fredericksburg region. That is, stay at home if at all possible, limit the others that you interact with. If you do need to go out, make sure you're always wearing a mask, staying socially distanced, wear the mask whether indoors or outdoors. We do have a new federal administration up in Washington, and I've noted even in the past day, there's a different tone and tenor and a different set of examples being set at the federal level with mask wearing and others. And so hopefully that will kind of spread and ripple through our society. And we know by taking those, we know the tactics that can keep us all safe, right? Staying at home at this point in time when the prevalence is so high, wearing masks, social distancing, those are the things that will lower the prevalence in our community and get COVID down to a more manageable level. We need to kind of pull the plug on COVID in our community so that the number of hospitalized friends and family goes down and our hospital can get back to a more normal set of operations. As Eileen has talked previously, we're still under the set of conditions in our hospital where there really is no visitation and other sorts of tactics that we've had to put in place to keep our facility as safe as it can be. We need to lower that prevalence, lower the number of hospitalized patients in our community, and get back to more of a semblance of normalcy. On the vaccine front, I know a lot of people very, very excited about the vaccine. The demand for the vaccine is very, very high. It's high in our community. I'm proud to say, as of yesterday, we have vaccinated over, I think, 12,000 vaccine doses we've administered here in Mary Washington Healthcare. That's just our healthcare system. Many of those even within the past week, as we have set up our kind of vaccine administration at our FIC conference center. Many members of our community have gone through there to receive their first vaccine dose. We've been very active vaccinating the priority groups that have been designated by the governor, including teachers and other priority group workers, and as well as members of the Commonwealth that are over the age of 65 and those that have kind of complicating medical conditions that are now eligible for the vaccine in the 1B group. And so as members of our community have been coming through the FIC Center, it's been pretty impressive. The feedback we've gotten from our community has been, I'm very grateful for it, but I'm more grateful for all the efforts of our team members that have put in the hard work to stand up what it takes to have that FIC Center operation run the way that it does, being able to vaccinate, 10,000 vaccines or more a week, it's very, very impressive what the team has built there. And I'm very thankful for all the members of our team that have pitched in to build that vaccination machinery that we have at our fixed center. It is super impressive. I'm also thankful for all the members of our community that have expressed outreach and the willingness to volunteer. The outreach has been overwhelming, I think is the best way to say it. And so we have had to limit our volunteers to a subset that can help us operationalize our vaccination operation at the fixed center. And so we're very appreciative. We have everybody else's name on the list. If we do get to a point in time where we need more, we have plenty of individuals in the community who have raised their hand saying, hey, I'm willing to pitch in if necessary. So we are very, very grateful for that. On the vaccine front and the availability front, we opened up appointments for all the vaccine that we had on hand this past week. And as of tomorrow, we're going to be at the point in time as we work through our scheduled appointments. We do not have any first dose availability left in our inventory. And the state just this week has changed their allocation methodology. They were shipping some vaccines directly to the hospitals and health systems. That has changed this week. The vaccine allocations are now going to the health departments and health districts. And so we're just uncertain as to how many vaccines we're actually going to be able to use at our fixed center in the coming weeks. And so we are unable to open new vaccine appointment scheduling until we have much more confidence in what we're going to receive and how we're going to be able to administer that to the priority groupings in 1A and 1B here in the Fredericksburg region. So we're in a period of uncertainty as kind of the vaccine distribution is changing in the Commonwealth of Virginia. But once we learn more and we're more confident about what that looks like, we will communicate to everybody on our website and talk about when we might be able to open up more of the appointment scheduling like we had done last week.
Thank you, Dr. McDermott. Dr. Newman, can you talk to us about how people can get vaccines or at least sign up to get vaccines? That's a common question we're hearing.
Yeah, there's a lot of uncertainty at this point about what the future will look like. Mike, as Mike just mentioned, we just found out that the Department of Health who is receiving a vaccine in our health system will not be receiving any future doses of vaccine, nor will any other health systems. So we are hoping to partner with the Department of Health. We're willing to help. I will just echo Mike's comments. I'm so proud of our team and the operation that was rapidly put together. We are able to deploy, roughly 1,500 first doses a day or upwards of 10,000 first doses a week. There's nowhere near that supply of vaccine in our region or coming to our state. At this point, we're hearing about 110,000 doses a week. So you can only expect in our health district to be getting 3,000-4,000 doses a week. So, but when that supply starts to increase, we are here. The operation is built, and we are willing to deploy that vaccine as quickly as possible. So, we'll be here standing ready. So I guess for those that are interested, and I do understand the demand is very, very high. I would, keep an eye on our local Department of Health's website. You can keep an eye on the Mary Washington website. As somebody who's been to Disney World, or any of us who've been to some place like that or bought tickets for a concert, it's like one of those kind of situations where, 6 months ahead, you're sitting there, with your finger on, the internet and hoping to get it. Within 1 minute, it's all sold out. That's very frustrating, and I'm sorry that we're in a situation like that. We really want to make sure that we have equitable distribution of the vaccine throughout numerous communities and numerous groups within our region. We really do want to make sure that those at highest risk, those over the age of 65 and those with some significant pre-existing conditions have access, but also many essential workers, a lot of businesses. This is essential. It's essential lifeblood to so many of the functions of society. I just look at how grateful I was to be able to help our school teachers and our school districts. And I know how important it is for schools to be back in session and kids to be back in in-person learning. That's a critical component. Postal workers, our first responders, there's so many that are just essential. And I'm just very hopeful that we start getting an increased supply of vaccine. And when it's here, we're ready. And I'll just sort of, one comment that we got, and the outpouring has been just wonderful. We are very grateful for the community's response to the vaccine clinic, and for those of us that have been able to see it in action. But somebody just said it's more efficient than Chick-fil-A. So that just, I think, sums it up. Anybody who's been to a Chick-fil-A, I'll take that as an enormous compliment.
And we're working very closely with our Department of Health. All these changes are new, the new changes in distribution and how the limited supply coming into the state is going to be allocated and distributed. All of this is brand new. And so we have a great partnership with our Rappahannock Area Health District, and we're working hand in hand with them to make sure that the supply that's coming into our Fredericksburg region, that we're working in close partnership to make sure it's administered in the best way possible for our health district.
Thank you. And Eileen, could you talk to us a little? Mike had shared with us, Dr. McDermott shared with us that our numbers are pretty darn high still in the hospital. And so that always worries our community about our staff, about our ICU capacity, what's happening in the hospitals, is it safe? All of those things. Can you share with us what's happening at the hospitals?
Sure. So as Mike said, 98 patients. We've been 98, 99 for the past 2 days, as Mike mentioned. The next number is not a number that anyone's looking forward to hit. It's not something we've ever wanted to accomplish, to hit 100. But we see that that's likely in our sights. And so it's the highest number ever. This situation is pretty much how it has been, in that our ICU is very busy, does have a lot of patients. Only about half of them, actually a little bit less than half, are COVID patients, but those COVID patients are very, very sick. We have 2 of our COVID units, 2 dedicated units at Mary Washington. They are full with COVID patients. The 3rd is half full. So that causes us to start saying, what about if we had to add an additional unit? What would that look like? At Stafford, it's a similar situation. Their ICU is about half full with COVID. And their dedicated unit is a little bit over half full with COVID. So we're in that place again of, so what happens if it continues to grow, and making sure that we have those plans in place. And so our staff, they rally, just like, you see that the vaccine clinic and what a great job they did putting that all together. They're coming to work every day, and they're taking care of the increasing number of COVID patients, and we are putting great burdens on them. We are asking them to do, huge things. We made a major change this week that we hope will help them to some degree, is that we worked on trying to streamline their documentation so that it would give them more time to be focused on their patient care. But it is tiring. It is, the work is huge. And as we're facing it continue to grow, you just keep trudging through, that path. Our staff are strong, our staff are resilient. They want to take care of their community. We all feel like that is our responsibility. The community is depending upon us, but it is very difficult. It is very hard. And is it safe? I still feel safer here than any place else. And that's just because that's what our environment is. And so, yes, is it safe to be here? Yes. Is it safe for our staff? Yes. Is it safe for our patients? Yes. Is it safe for visitors? No. And the reason is because we don't know where our visitors have been. And that breaks my heart as a nurse, because a very important part of someone's healing is having their loved ones and having their support system with them. But we can't, because every new person that comes into our building is potentially a carrier of COVID when you look at the prevalence. And we just can't place the people in our buildings at risk that way, not our patients and our staff. So we are still doing all the things that we've done all throughout this. It is discouraging some days when you keep looking at the number and the number keeps getting bigger. But that's what we're here for. And we take our responsibility very seriously, and we want to be here for our community, and we are.
And today is a bit of a monumental day, is it not, Dr. McDermott?
Yeah, it was a year ago today, I believe, in the state of Washington that the first COVID-19 diagnosed patient happened. So here we are on the 1-year anniversary of COVID in the United States, as far as the first diagnosed patient to have COVID-19. And so it is a time of reflection a little bit. You know, when you hear that, you reflect back on the past year and how much has happened and how much has changed and how different society is, even from that point back last January to today. But there is hope on the horizon here with the vaccines that we have that have been received their FDA emergency use authorizations. There are others on the cusp of that as well, going through that process. And as those vaccines become more available and we can get more members, of our country vaccinated, that's hope on the horizon, and it's a way back to some sense of normalcy or pre-COVID conditions. So we can all be hopeful for that. But until that point in time, we need to all do what we know can keep our prevalence low from this terrible virus, and that is, stay at home if at all possible. If you do need to be outside, wear a mask at all times around others, both indoors and outdoors. Social distance, and practice exceptional hand hygiene. All of those things very, very important. I can't say it enough. I know I say a lot, but I can't say it enough.
As we reflect back at a year, it's funny. We were talking internally, and in some ways, I could believe you could tell me it's only been 2 months. Because we've missed all our milestones, we've missed holidays, we've missed events. Every day just seems to blur into each other. Yet it's also been so hard and consumed all of our lives so much. You could tell me it'd be 5 years, and I'd believe it. It's funny how we perceive time, in an event like this. But a lot of bad, obviously, over the last year. But I also look at all the good. I just grateful to be part of this organization and just seeing people rise up. I'll be heading into my 2-year anniversary here as a member of this community, and I've just been so impressed and grateful to live in this community, because just seeing the outpouring for our staff from our community over and over, always willing to help, always willing to pitch in on numerous levels. So there just are a lot of reasons for optimism, a lot of positive that have come out of this year too. And I do try to focus on this as we continue this difficult struggle.
Thank you. I'd like to switch over to some of our community questions, and some of them you've already answered, but we might repeat some just so some folks joining us a little late might hear them. The first question is, do we know anything about the vaccines that are on the cusp of being approved and available, like the Johnson & Johnson vaccine, for instance? Is there any idea on the efficacy of those that are about to come out? Are they very similar to the others? What do we know?
Don't know a lot yet. There are some differences, that are good for developing countries and some of those other kind of situations as well. The 2 vaccines that have come out thus far are very technically difficult to manage. They require super freezers, and there's a limit to how long it can be good after thawed, and they are a little bit difficult to manage. And as you look in the developing world, those kind of vaccines would just be very, very difficult to deploy across large populations. So I think there is some positive in that many of these vaccines do not have some of those requirements. And I've heard that they may be a single dose vaccine as well, which is another part of the vaccines that we have that become technically difficult, is getting that second dose scheduled and making sure somebody's compliant to come back with that second dose. So hopefully within the next few weeks, we'll have information more specifically on some of the safety and the efficacy as that begins to come out, and some of the specifics. And again, I'm not quite sure how much of that will be available in the United States versus other countries. We've been lucky in some ways. As bad as the supply is here, we're lucky to have it. There are many countries that don't have access to it at this point.
There are some technical scientific differences between the vaccines. The 2 vaccines that have received their EUAs, Pfizer, Moderna, you consider them to be like brother and sister. Some of these other vaccines would be more like cousins, and they have different scientific and technical approaches about why they are a vaccine and how they work. But as they go through that FDA emergency use authorization process, that's when all that information becomes very public about what is the safety profile, how efficacious is it, and all those sorts of things. So that data is yet to come. I do know there's a lot of hope and optimism for all of these vaccine candidates from the data that I've seen. And so they all look very good from their preliminary data.
Thank you. And I'm sure we'll address that as we hear more in our future town halls. So some of the questions are around the partnership with the Rappahannock Area Health District. Is Mary Washington Healthcare partnering with Rappahannock Area Health District where maybe we can vaccinate people who are on their list?
Yes, yeah, and so that's some of the details about why I say with this new change in distribution and allocation, we've been in close partnership with the health district, and we've been working with them. And take, for example, school teachers and others. We work in partnership to talk about, okay, how are we going to address those 1B priority groups and populations, and who's going to do that? We do that in partnership with the health district. And so as these new allocations come to our region, the Rappahannock region, we'll be working with them to say, okay, well, this is how much vaccine is coming in. How are we going to deploy that here in our community, and how are we going to go through the people that have registered on the website and are interested in the other priority groups? That's done in partnership with the Rappahannock Area Health District, and we've been doing that all along, and we'll continue to do that as we move forward. It's a little different now because the distribution is happening differently, and so we need to all get together and make sure that we're all in sync with how we're going to move forward. And that's the process that's happening just now.
Thank you. And because of this new distribution model, do we have any idea of when the next round of appointments are going to open up?
I would the new distribution model, like as far as the open appointments on our website, I think it's likely to be middle to the end of next week before we have a significant update to know how many of those appointments we would have available for you to sign up through our website. And so I think we have several days in front of us to figure out, okay, when is that vaccine distribution going to be here and in our possession? And then therefore, how can we turn around as quickly as we can and get it into the bodies of members of our community, which is what our goal is to do that as quickly as possible. It's just, there's too much unknown right now, and I don't know exactly when those appointments will be up again on our website. Still need to work through all that. The last thing we'd want to do is get an appointment up there and then not have vaccine for somebody when they come in and they thought they had an appointment. That'd be very, very disappointing. And so, we want to be very careful about how we do this and not overpromise. We want to do it responsibly.
Another question we've had is, are we reserving the second shot for those that we've already given?
Yeah, we currently are making sure that the plans are in place to administer second doses to everybody who's gotten their first dose. So that is the current process in place. Those plans are in place to be able to do that, correct. That could change if there's different changes in federal direction and other things, but to alter that plan, there's a lot of logistics that need to be solved for, including very high confidence that there's going to be an abundance of more vaccine in the very short term. So right now, the plans are in place to make sure the second shots are there for everybody that's gotten a first shot.
Great. And can people get the vaccine at Mary Washington Healthcare's clinic if they're not a patient of our health system?
Yes, that is not a restriction. This is for our entire community. There is no charge for the vaccine. We do not look at insurance. So if you're scheduled, if you're in one of those categories, the 1A category, which is the broader healthcare group category, healthcare workers, or 1B, which is over 65, 16 to 64 with a pre-existing condition, or certain groups of essential workers, you can get a vaccine at our clinic.
And if you have been fully vaccinated, both sets of doses, can you still carry and spread COVID to others?
Yes, unfortunately, yes. The vaccines are very efficacious in the 94% range. So that's great news. But there are a subset of people who can still develop COVID despite being vaccinated. And in the studies, the endpoint was not really that asymptomatic COVID. So it is possible that the vaccination could prevent you from severe COVID or even symptomatic COVID, but you could potentially get it and transmit it to somebody else. So we have to continue social distancing. We have to continue masking. We have to continue a lot of the things that we're all doing to keep our community safe until the viral load in our community drops down, until the rates drop down. And what many public health officials talk about is that positivity rate of about 5% or less is when, and a large number of our community has been vaccinated. That's when we'll start being able to begin to lift restrictions. We're nowhere near that at this point. And I'm very concerned about the new strain that's coming as well that could be much more transmissible.
I think it's very important. I mean, like getting both doses of your vaccine is not a get out of jail free card, or I can go about life and I'm bulletproof in any way, shape, or form, because you could acquire subclinical COVID and spread it to others in the community who maybe have not been vaccinated, and that would be a tragedy, right? And so we need to keep responsibility, personal responsibility, knowing that there's a chance of that. The vaccines do look to be extremely effective in preventing severe COVID, though. That is the greatest benefit of these vaccines is if you receive both doses of the vaccines, your chances of having very severe COVID are infinitesimally small, actually, is what the vaccine data is showing. So that's why they're so efficacious, but it doesn't mean that you couldn't catch it a little bit and spread it to others. And that would be irresponsible if you were acting in a way where you thought that couldn't happen.
So we are getting a lot of questions about, hey, I registered online and I haven't heard anything. We don't currently have a registration for our clinic. It is kind of a first come, first serve availability appointment scheduling. So we are presuming that means they are registering on the Rappahannock Area Health District website. Can we talk a little bit about, is that still what they should be doing? And is that their best first move?
Yes, I think it's a good thing to do to register on the Virginia Department of Health website, which, and if you're in the Rappahannock region, that comes to the Rappahannock Area Health District. We're going to be working with the health department to address the list of interested parties and make sure that they qualify under under the current priority groups, which are 1A and 1B currently as designated by the governor. And those if you want to read more about those categories, it's on the VDH website. You can go there and read about where we currently are. So I do think registering is good. I do think it's also good to keep an eye out. There could be an opportunity where we have the availability to do some open appointments for vaccine that we have on hand that we want to get into individuals. So I think it's good to keep your eye out in multiple ways. Registering is a good way, but also keep your eye out for other opportunities that could come up for you to get the vaccine faster before somebody's able to contact you, working their way through that list.
And we also should reassure people it may not be immediate. It sounds like because the vaccine is a little slow to get distributed, it's a low number coming into the community each week, we're not going to be able to vaccinate the whole list right away, right? Is that how it should be looked at?
Yeah, that's exactly right. I think people need to just exercise patience, and I know that's hard to do. So many people are just desperate to get this vaccine. I think of many seniors I know that have really been on house arrest essentially for a year. They're very concerned about leaving their home, as they should be at this point, especially with how rampant it is in our community. I understand, but we are limited by the number of doses we're getting. Everyone will get the vaccine or have access to the vaccine. It's hard. That timeline is hard to predict at this point. The positive is, as we discussed earlier, there's new vaccines coming out. There's been a change in administration, so there may be a change in priorities of production. Initially, a couple of weeks ago, we were talking this, the state had vaccine, but no means to distribute that vaccine. So, it was sitting in freezers. At least that's not happening anymore. We, as well as many other health systems and other areas, have deployed clinics that can rapidly vaccinate people. They're ready to roll. So as soon as we get that gas, the car is ready to go. That's the way to think about it. So patients. It is frustrating. I know a lot of people are wondering, well, why did that person get it before me? I should have got it before them. That's understandable. Category 1B is half the Commonwealth. It's a big group of people, and everybody would like to argue why their status makes them a higher priority. But right now, the priority is just to get vaccines so that we can get all of you vaccinated.
Thank you. And we are hearing some questions about when and how to get their vaccine. If somebody has registered for appointment and they come in for their first appointment, but aren't available in the window of time for the second appointment, should they try to get it if they're out of state in the state they're traveling to? Can they wait the time it takes for them to have some travel to come back and get it? Is it safe or effective to get it if you don't get it in the right window?
Yeah, no, it is safe to get it. These vaccines were studied in a very specific way. The Pfizer vaccine was studied, with the second dose coming at 3 weeks after, and the Moderna coming 4 weeks after. But just scientifically knowing how our immune system works, knowing how vaccines work, a few days on either end is really nothing too much to be concerned about. The important thing is get that second dose. When you can get it, so that you're fully protected. The first dose, roughly 12 to 14 days after the first dose, you have some protection, but it's really in the 50% range. So you really need that second dose to get that full protection. But just because you can't make it exactly 3 weeks afterwards, or the scheduling problem, that should not be an obstacle to you getting your second dose. And we are holding those on reserve. So I'm sure we can work around it from a scheduling standpoint. We are reserving those second dose vaccines for a period of time for sure.
We are hearing that some people are getting confused a little bit between the clinic they attend, whether it's Mary Washington's or Rappahannock Area Health District. The Rappahannock Area Health District is holding theirs at the Expo Center, where we're holding ours at the Fix Center on the Mary Washington Hospital campus. So the questions we're receiving is, if I received my first dose at the Expo Center, which would be with the Rappahannock Area Health District, but not able to get that appointment for the second dose, should I sign up with Mary Washington to complete the vaccine course?
No, our signups are for first doses. Yeah. And then when you get your first dose, we sign you up for your second dose. That's kind of how it works. So you should be contacting the Department of Health for your second dose if you got your first dose through them.
Thank you. Can you give some examples of some of the underlying health conditions that are considered in that expanded 1B group?
Yeah, it's really very broad and very common conditions, such as heart disease, diabetes, high blood pressure, smokers, lung conditions such as asthma and COPD. So it is, obesity. So very, very common health conditions that many of us have. That's why that group it approaches nearly 50% of our Commonwealth's population.
And is there any concerns about the vaccine interacting with folks who have allergies? What kind of allergies could potentially be a problem when receiving the vaccine?
There have been very few allergic reactions to this vaccine thus far. You have to remember, we've given this vaccine to over 10 million Americans at this point, well over 10 million Americans, I suspect, at this point. And there's only been a very small handful of allergic reactions. And it's this serious allergic reaction called anaphylaxis that we're most concerned about. And that's a sort of a life-threatening allergic response that can happen a few minutes after the vaccine is deployed. That can happen with any vaccine. It can happen with any medication. It can happen with latex, foods. It's really it's something that can happen with a lot of different things. This is not specific to a COVID vaccine. So if you've had a history of anaphylaxis, that is not a contraindication to getting the vaccine, but we would be a little more cautious in observing you at that point. And in fact, anybody who's been to our clinic or had the vaccine, we are currently observing folks for 15 minutes after they received the vaccine. That being said, the anaphylaxis is extraordinarily, rare.
Is there any?
And remember, we have 4,000 Americans that are dying every day from COVID-19 disease. Yeah. Right? And we've administered over 10,000 vaccines, and there are no deaths from the vaccine, and very, very few significant reactions. And so this vaccine is extraordinarily safe. We're administering it like there's lots of individuals that have come through our clinic, and we've done, like I said, over 12,000 doses, really over 14,000 doses at this point in time. You know, given it to lots of individuals who I have history of severe allergies. I've had EpiPen shots before, all of that. And it's very, very safe, even in that population. It doesn't mean you shouldn't get it if you have an allergy. It does mean we're going to watch you like is recommended to do, but it's still very, very safe to get the vaccine.
Thank you. We have one viewer who mentioned that they've read there is a possibility that the vaccine may be less efficacious for those that are 65 and older. Is there any truth to that?
Well, the vaccine creates immune response, and the younger you are, the more of a robust immune response you develop. And in fact, younger individuals who get the vaccine sometimes have more side effects. That's because their immune system is revving up more robustly, and you can get those aches and the fevers and the chills and stuff the day after you receive the vaccine. And that's really not a side effect of the vaccine. That's your immune system revving up. So the older we are, the less of immune response that we do develop. That being said, it is safe in those over the age of 65 and still efficacious in most people receiving it over the age of 65. You develop enough of an immune response to prevent you from developing COVID, or even if you do develop COVID, it would prevent you from developing life-threatening or very serious COVID. So it is very, very important, particularly in those over the age of 65, to get this vaccine.
As the studies have shown in those populations, it is very effective in preventing serious COVID, right? And that's really what we're talking about. So talk about the degree of immune response and all these sort of things. Well, the studies have shown with the people who've gotten it, if you get the vaccine, it is extremely effective at preventing severe COVID-19 disease. And that is what is important.
Yes. Thank you. And any news about children? We have, there are children with underlying conditions that people are concerned, and the vaccines currently are not approved for under 16. So is any of the vaccine production being tested on children yet?
My understanding is those kind of trials and those studies are going on right now. I believe even our partners, Children National in DC, are involved and are probably more expert in the vaccination in children. And as soon as we know it's safe, and as soon as there's FDA emergency use authorization, we would open it up here to children when the governor would put them in a priority group that's appropriate. Yes, there's a lot of questions, not only about children, but pregnant women, breastfeeding women, a lot of those areas. And I think people think that it's not safe for those categories. It just hasn't been studied in a large enough amount to be able to say that with certainty. But particularly with pregnant women, the American College of Gynecology has come out in favor of pregnant women getting the vaccine. That being said, that would be a personal decision and something you would have to consider, and your risk of getting COVID, and exposure while you're pregnant. But all that will be coming out. These vaccines have only been with us a matter of weeks, so there's a lot of more unknowns down the road.
And for clarification, for some of our viewers are asking one more time, the confidence of going ahead and filling out that survey on the Rappahannock Area Health District VDH website, that will cross over and coordinate with our clinics.
It's not, I can't confidently say that is perfect, right? So that those lists on the VDH, the Virginia Department of Health site, which I do believe for our region get forwarded to our local health district. That's one way to announce that you are interested in the vaccine. It doesn't mean that, or at least I don't know, because I don't get those lists directly sent to me. It's absolutely confident it's going to cross over to Mary Washington Healthcare and what we're doing in our community as well. So I cannot say with confidence that list gets you on our list, because the systems don't talk like that. But it is one way of registering your interest, and you could get notified from that list that there's availability. But keep your eye out for other areas of availability too that could be coming, because all of these lists, I don't believe, are talking to one another perfectly.
Thank you. And is there any contact tracing going on in our community?
There is probably some, and that would be a question better for the Department of Health. But I will just put out there that contact tracing is really for an early stage of an illness like this to contain it. The cat is out of the bag. It is rampant throughout our community. There just would not be enough people to even think about or contemplate contact tracing every individual with COVID. There's so many people carrying COVID, coming down with COVID every single day, that it's just not practical at this point to do the contact tracing like we were doing early on in the pandemic.
I mean, when you think about that, I mean, it is so prevalent right now, COVID is. And when you think of the amount of people it would need to attempt to do that contact tracing, I think every one of us in the community would have to be contact tracing in some way to get it. It's just, once you get to a certain scale, it's like all bets are off. You can't do this anymore. It is just too prevalent. You have to assume, I mean, I do think that mindset that assume everybody's infected, everybody that you're interacting with at any point in time. I mean, the prevalence is just very high out there. And when you go into an environment, the odds that somebody has it in an environment with a certain amount of people are pretty high at this point in time. It's very prevalent in our communities. That's what's creating the pressure on our health system. And so we need to take the steps to make sure you don't get it, which is don't enter those environments. Stay home if at all possible. Really limit interactions with others. If you do have to have interactions with others, wear a mask at all times, indoors and outdoors, social distance, practice exceptional hand hygiene. Here I am, I'm saying the same things all the time, but they are the things that can keep us all safe and that can lower the prevalence of a communicable virus like COVID-19 is, the coronavirus is, right? We know that's how it transmits. You have to be near another person to get it. So if you limit those interactions, you lower your chance of getting the virus.
Now, Dr. Newman, you had mentioned earlier the new variants of the COVID-19 disease. The viewers are asking, what do we know about it? Can we describe the risks of this? And do we even know if the treatments that have been successful, like monoclonal antibodies and the vaccine, do they work against these new variants?
Yeah, a couple comments on it. Number one, even though a formal case has not been reported in our community, we have to assume that it's already getting here. There are cases popping up across the country. We're not testing, every test is not a test for this variant, it's a test for COVID in general. And most public health experts feel that this will be the dominant strain in the United States by February to March, which is very concerning because it's not been shown to be more severe than the initial strain of COVID or more deadly, but when it's much more transmissible, and what I'm seeing is 50 to 70% more contagious, you can think of it, than the typical strand, that is a lot more people that are going to get sick. And as a percentage, a lot more people that are going to get sick enough to come to the hospital. And as a percentage, a lot more people that are going to die from COVID. And that is, as a public health matter, that is what's really, really concerning about this. If we're looking at just extrapolating the numbers, instead of 4,000 deaths a day in the United States, we could be looking at 6,000 to 7,000 deaths a day in the United States by February or March. That's really tragic. That's catastrophic, and that is what we're concerned about. They are developing new monoclonal antibody drugs to kind of look at the different variants and make sure that it matches up with the new strain. So that is, I know, ongoing. And the vaccines, at least at this point, appear to be effective for those new strains. But when we look at social distancing and masks, we're thinking of the old strain. And, I think it's a little bit of an unknown of how contagious this new variant will be when it becomes the dominant variant. And what are we truly going to be facing, as far as the curve in our community? It's already at a very steep rate. It's hard to imagine it going much steeper, but it could.
What Chris just said is very important because it's not intuitive, right? Because if you were to ask most people, which would you rather have, a variant that's more contagious or one that creates greater disease severity? Most people would say, like, well, I don't want greater disease severity. I'll take the more contagious one. But when you run the math on those, the more contagious one is actually way worse because more individuals will get it. And even at the same level of severity, more people die with the more contagious one. So this is actually an epidemiologist's worst nightmare, a virus that's more contagious rather than one that morphs to one that has a little bit more severe disease, but the same level of transmissibility. The increased transmissibility is actually way worse. And I know that's counterintuitive when people think about it, but that's the facts that we're dealing with. And that's why the epidemiologists are so concerned about these variants that appear to be significantly more transmissible.
That's right. And we saw that with the first SARS outbreak 20 years ago. That was a very severe coronavirus and, deadly. So it didn't have the ability to transmit very readily, and it burned itself out very quickly. This is just the opposite. Most people get this, don't get that sick. So it is spreading like crazy. And a subset of people are getting very sick then from it and dying. And that, as from a containment standpoint and from a total death standpoint, a more contagious virus is much, much worse.
Thank you. Eileen, are we seeing a lot of our entire staff vaccinated yet? And for those that are not vaccinated, are they still allowed to work?
Yes, they are. So the vaccine is voluntary for our staff. We are strongly encouraging them to take the vaccine. And so those that have wanted to be vaccinated or vaccinated, we still have a small amount of vaccine available for those that still want to be vaccinated. So yes, we have vaccine available for our staff. If our staff choose to not get the vaccine, yes, they are still allowed to work. We need them here. And so we are practicing just like everyone else. We are masking in the hospitals. Everywhere you go, we're masking. We have, by design, created cohort units where our COVID patients are. So keeping those units contained with the staff that are taking care of them is trying to do our best to make sure that COVID certainly isn't transmitted, within the hospital. But yes, I mean, that's why we're emphasizing and encouraging our staff to get the vaccine. Is we need them here as the numbers continue to grow. We need them here to take care of our community.
And there are a lot of questions coming up about a recent article in the newspaper about offering a bonus to our associates who receive the vaccine. Questions vary from, the amount that's given to, is this punishing those who don't? And what about those that can't get the vaccine for a variety of reasons? Could you address what we are doing around that and why we incentivized the vaccine?
The idea wasn't ours, right? There's lots of health systems around the country that are actually doing this for the exact same reasons that Eileen just described, which is we're under periods of extraordinary pressure as a health system. We need every single member of our team, no matter where they work in our health system, to be healthy and available to pitch in for the care that we need to provide. And that includes clinical folks and non-clinical folks. We have lots of individuals in our organization that don't typically work on clinical floors, pulling shifts on the floors, answering phones, doing duties up there that are needed on the floors so that the nurses and others can provide the care that's needed to our community currently. So everybody who's on our team is on our team, and they can be put in at any moment's notice to have to provide care for our community. And so to do that, we want everybody safe and protected, right? We need everybody on our team available at this point in time. So we are incentivizing our staff to get the vaccine, right? And we're calling it's a voluntary bonus, a couple of criteria. You have to work a certain amount of hours and you have to have gotten both doses of your vaccine. And we're going to be giving a $500 bonus to those individuals in our organization that voluntarily have decided to qualify for that bonus. And we're calling it a hero bonus. It's what most of the hospitals and health systems around the country are calling it. And so we shamelessly kind of copied the idea from others. We shamelessly copied the name from others, right? It's not our idea. We didn't come up with it originally, but most health systems are doing something like this because across the country, we're all in a position where we need every single member of our health system team available to provide care to our community.
Thank you. Some more questions about vaccine and how people qualify. If somebody is in that 16 to 64 with a medical condition, do they need to provide any kind of documentation to prove that they fall into that category?
We're currently not requiring documentation. There is a bit of an honor system with there. So we hope that when people sign up, They do disclose, a pre-existing medical condition. There is a drop down in a checklist, and they attest that they have one of these common conditions. But we're not looking to police it or be an obstacle to people receiving the vaccine or turning somebody away because they forgot a doctor's note. And it also puts a lot of stress. I mean, our primary care docs are under an enormous amount of stress at this time too. And to create that level of bureaucracy for thousands of people calling their primary care doc for, notes, that doesn't make any sense at this point either. We just need to get vaccine to people. And as that supply comes in, Mary Washington is committed to getting it to our community.
The governor has designated the groups, and I think the citizens of the Commonwealth can look at those groups and recognize them and abide by them. I think the grouping and the prioritization makes sense, and that we are focusing on the individuals that will most benefit from receiving the vaccine.
Thank you. If somebody has tested positive for COVID and they're about to get vaccinated, the question they're asking is first, am I likely to get it again, or am I a danger to someone else? I also want to emphasize, should they be coming to get the vaccine if they've just tested positive?
Absolutely not. So
Thank you.
If you just tested positive for
30
COVID,
days.
you need to isolate yourself for 10 days and not release that isolation until you're asymptomatic. So that, first of all, please do not come to our clinic and expose our staff and the other people in our community coming to get vaccinated to COVID. The other thing I would say, the vaccine at this point is a scarce resource. So when you have COVID, in all likelihood, you're immune to COVID, to getting it again for at least 90 days. So let somebody who hasn't had COVID, get the vaccine in front of you for the most part. There's no reason to say that it isn't safe, though. So, as the vaccine becomes more available, and, as we've looked at maybe some of our high-risk healthcare workers and others, there does not appear to be a safety issue in getting the vaccine if you've recently had COVID. It's really just more, if you've had COVID, let somebody else protect themselves. You probably have protection for 90 days. The one caveat is if you are in a category where you qualified for monoclonal antibody and did receive monoclonal antibody, the CDC is recommending that you wait 90 days after that because you have that immunity now from the monoclonal antibody.
The vaccine is not a treatment. So if you come down with COVID, don't think, oh, I'm going to run in and get a vaccine. It's not a treatment. And so if you're diagnosed with COVID and you walk into our vaccine clinic, you've just put a tremendous amount of individuals at risk. It's really irresponsible. It is not a treatment for COVID. And so I hope nobody's thinking of it out there like that.
Yeah, if you just think about how the vaccine works, and I just want to reiterate this because a lot of people are getting this wrong. It takes about 10 to 12 days for that immune system to start building up after that first dose. So again, so many people get that first dose of the vaccine and then engage in riskier behavior and get COVID right away. So it's at least 10 to 12 days. If you have COVID, you're likely going to be recovered within that 10-day window before that vaccine would even be kicking in. So
your body's building an immune response to COVID if you've been diagnosed with COVID.
Yeah, right.
So vaccine is not a treatment. It's not gonna help you at that point. And going somewhere and receiving a vaccine, if you're just diagnosed with COVID, is putting others at risk. You should be isolating at home if you've been diagnosed with COVID.
Thank you. And does our community need to have MyChart before making a vaccine appointment?
You don't need to in our system, but we recommend everybody sign up for MyChart because it tracks your vaccine. It has it in there. Your second dose appointment and all those things would be there for you to see in MyChart. And it's a great way for you to have access to your health record. So it's a good idea to do it anyway. I encourage everybody who's listening tonight, even if you don't have a vaccine appointment, download MyMWHC, the MyChart app. From the App Store, get it installed, and it'll be much easier when you do have the availability to get an appointment to just sign up and get the appointment. It'll be even more seamless if you sign up for MyChart now. So we are encouraging everybody that comes through. There's waiting time after you get your vaccine, and we're telling you, sign up for MyChart while you're here. Get it all programmed in there. Then your vaccine is tracked. It's part of your record. It's a good idea to do. I encourage everybody listening to download the MyMWHC app and get it all set up and ready.
So as we're getting closer to the end, I'd like to just get through a couple more questions before we close. Can we say with confidence that maybe in the next few months, everyone in those current priority groups could have the vaccine? How soon do we think that that priority group is going to be met?
I don't know. Like, I'm just being honest. Like, I do not know. And it's changing. I mean, just look back at the last 4 weeks, right? It's, only about 4 weeks ago, we were giving our first doses of vaccine. And a week before that we had any information about how they were going to be shipped, received. Are they coming with the syringes? Are they like, nobody knew any of that just a few weeks back, right? And now we get to a point in time where, and like we've said to everybody today, we're so proud of all of our members of our team who have come together to build our vaccination capability at the Fix Center, right? It's a very, very impressive operation. It's extraordinary, actually, what we have built in a short period of time and what it's capable of doing for our community. We're very, very proud of that. But at this point in time, when you forecast out, even with all the insight that we have, we don't know what vaccine is going to be coming into the Commonwealth of Virginia, looking out even over like a 3 or 4 week period. We assume it's going to be at the rate right now. The best assumption we have is about 100,000 doses a week for the next 4 weeks coming into the state. That's the entire state. We know our Rappahannock region is about 4% of the population of the state. So if we get our allocation, you're talking about a few thousand doses available every week for the next few weeks. That's the best of our vision. What happens after that, or like, I don't know. It could change next week. Maybe there is more Pfizer ramp up capability and it's going to be shipping at higher levels than anybody expected. I mean, that would be a pleasant surprise. That would be fantastic. But I don't think anybody could truthfully tell you when we're going to be through the priority groups and when it's going to be available to 1C and then the general population at this point in time. I know some of those promises were made early on saying like, hey, by the summer, everybody should be able to have it. I don't know. I don't know now, looking at the supply and the way it's coming out, whether that's reasonable or not. I just think that's my honest look at it. I don't think we know.
Thank you. So unfortunately, we can't get to all the questions. There's probably a good 30 more questions that we weren't able to get to tonight.
Sorry.
So please tune in again next week. I think we've covered a lot of it. So I'd like to ask Eileen, we've had a few people talking about what can we do for those that work in the healthcare system. We get that question every week and we greatly appreciate it. So what can they do, Eileen, to express their appreciation, and what have some of our community members done for us?
Well, as we've said in several different examples already tonight, our community has been extremely generous. So whether it's been volunteering at the vaccine clinic, even the generosity of the compliments about, the vaccine clinic. I mean, for as long as this has been going on a year, it's nice to hear nice things, I mean, it's been rough. And so the compliments of our community, mean a lot. The generosity of our community. I was, commenting earlier today with our team that, we have as many meals coming into the hospital donated by people in our community for our staff as we did in the very beginning. And that's great. And we are very grateful. So, we very much appreciate the community donations. The link is here for those that would like to make a donation in honor of our true healthcare heroes that are here every day taking care of our community. There's also the opportunity to give to our foundation, the Mary Washington Hospital Foundation and the Stafford Hospital Foundation. So you see those websites here because that's money that we put to good use to take care of our associates that come to work every day and just do an incredible job. And what Mike said earlier is true. It isn't just the people that work for Mary Washington Healthcare in our hospitals that are in our hospitals. We've got people from the finance department, our IS department. For those of you that have been to the clinics, you've seen you've seen the name tags. That name tag doesn't say I work in the vaccine clinic. The name tag says I work in IS, or I'm a nurse in a doctor's office, or I'm a nurse on a unit. Everyone has, come together, and we are just also extremely grateful for the support of our community. And please continue because it does mean a lot, and it goes a long way, and it provides great uplifting, good feelings for everyone that's here.
Thank you. And thank you to all of our panelists for once again another great night here hosting our town hall. Many of our viewers have asked about where do I get advice? Who can I talk to? And we have a hotline. Mary Washington Healthcare has a free nurse triage line where you can get advice about the vaccine, about your healthcare symptoms. If you're feeling unwell and not sure where to get care, our HealthLink Nurse Triage line is available every day, 6 a.m. to midnight. They can talk to you about your symptoms and offer care advice. And just a reminder, the Rappahannock Area Health District, it continues to host free COVID-19 testing, an important thing with the numbers we're seeing in our community and the numbers we're seeing in our hospital. They have dates in January and February where you can go to get a free COVID test to ensure that you are properly quarantining and not spreading this disease to others in your family or in your network. And just keep in mind, we will be back again next week. Our panelists are ready to come back on Thursday, January 28th at 6:30 to keep you updated on the latest news about COVID-19 and vaccines in our community. And as we continue through the winter season, we ask that you please stay safe and healthy and have a good night.